All right, so good afternoon, everyone. Let me just check if this is working. Trying both buttons. There we go. All right, perfect. Hi, everyone. My name is Christopher Barwa. I work for the Namibia Red Cross Society as basically the regional representative for this region. And I'm basically here today to just explain to you a bit about the work that we do at Namibia Red Cross, and then how you can be involved in and what are some of the ways in which you can make a career, come and make a career at Namibia Red Cross, basically. All right, so I'm first going to start by speaking on the mandate of the Namibia Red Cross. So the Namibia Red Cross is a national humanitarian organization. We're established by an act of parliament. And basically the Red Cross Act and the Disaster Management Act gives the Namibia Red Cross the mandate of being the second responder in times of disasters and emergencies. So like if there is a big emergency, like an example that I can give was last year, we all know there was a huge fire in Walfish Bay, and that was basically declared an emergency. That's why we saw a countrywide response. Namibia Red Cross was also one of the biggest responders to that fire, where we provided, the fire victims with food items, clothing, as well as cash distribution afterwards. So we have the mandate of being the second responder in those times. So it could be a flood, it could be tsunamis, basically, earthquakes. We are the first responders. Or the second, we have the mandate of being the second responders, first responders obviously being the government. All right, so we call ourselves the National Society. So wherever you see National Society there, that's Red Cross basically, or Namibia Red Cross. So we have auxiliary status to public authorities. Auxiliary, basically you'll see there, auxiliary means help. So we basically are established as a humanitarian organization to help, so public authorities being the government, in supporting basically vulnerable people, right? We are also, the organization is admitted as a member of the IFRC, and we're recognized by the ICRC. The IFRC is the International Federation of the Red Cross, right? The head office of the IFRC is in Geneva, and basically the IFRC facilitates partnership between all the Red Cross societies in the different countries. I don't know if you know, there is almost in every country a Red Cross society. So there is a South African Red Cross Society, there's a German Red Cross Society, there's a Ukraine Red Cross Society, and we basically partner with each other, and that partnership, however it may be, is facilitated or supported by international federation. So we work together. I always say the good thing, one of the good things that I like about working with Red Cross is that I have colleagues in around the world who I speak to on a daily basis. So it's a really nice thing. We're also recognized by the ICRC. The ICRC stands for the International Committee of the Red Cross, and basically ICRC is more involved in like war-torn countries, armed conflict. ICRC would be mainly the ones responding to that, and then supported by the Red Cross Society in that country. So we're recognized by the ICRC. Should there be ever a war situation in Namibia, ICRC would be responding, supported by Namibia Red Cross. All right. So yeah, that's just a bit more. We're recognized as a voluntary aid organization. Like I said, auxiliary to public authorities. We're there to help. We are independent, and that independent and voluntary nature is at all times respected. So like I said, we're there to help government, but we're independent from the government. We're not a government organization. We're an independent humanitarian organization. And we are the only Red Cross society in Namibia. And this provision, so these are basically provisions of the Red Cross Act. And that last line there basically means that the state must abide by those provisions. Right, so the National Society, which I said is Namibia Red Cross, cooperates with government at different levels in the management and prevention of disasters. So your floods, your droughts, fires, any type of disaster you can think, hazards. We cooperate with government at different levels in the management and prevention thereof. Promotion of health and the reduction of human suffering generally through various programs for the benefit of affected communities. So in terms of health promotion, we mainly do awareness and advocacy at community level, and then with different stakeholders. So like with the COVID pandemic, we had volunteers going around in communities. When COVID first came, a lot of us did not know what it was, did not know how it spread and so on. And so basically Red Cross came on board to support the government in terms of helping people understand, how COVID spreads and so and so and so. All right, so that's just an idea of what we do under health promotion. My presentation is very short. Please feel free to tell me if I'm too fast or if you want me to repeat something, please do feel free. All right, so like I said, Red Cross is independent from the government, and at all times we operate in line with fundamental principles of the Red Cross and the Red Crescent movement. So these fundamental principles are humanity, impartiality, neutrality, independence, voluntary service, unity, and then universality. So these fundamental principles basically help us to ensure that we provide aid that dignifies people. All right, it upholds the dignity of the people we're responding to. We remain, an example of being impartial is as Red Cross, when we're responding to a certain situation in a community, we're not asking what race are the people. We're not responding to only one certain type of race. We're not only supporting people with different ideals. We're supporting everybody in that community. So we operate at all times in line with those fundamental principles. We are neutral in, like I said earlier, I spoke of if ever there was a war to break out in Namibia, and we are responding with the support of the ICRC. We remain neutral in that when we are responding to that conflict, we don't take sides. We're not only going to be supporting the Namibian side, even the armed conflict or the rebels on the battlefield, they will also receive assistance. So like in terms of first aid and so on, we support both sides. So we remain neutral in that. In fact, just a fact, an interesting fact, the Red Cross was in the beginning established in a wartime. And it was established to provide basically first aid to people who were hurt. So like soldiers and then civilians who were hurt in war. So that's, I think, where the neutrality in war comes in. All right, so our focus areas in terms of what work do we do at Namibia Red Cross, for one is disaster management, where we respond to disasters. So if a fire happens, we would then, once we verified the information, where the fire happened, what happened, how many people have been affected, we then decide, okay, what are the needs on the ground? Do people need water? Do they need shelter? Do they need clothes? Do they need food? And then we respond with that aid, basically. So that's disaster response. Disaster preparedness, basically, some disasters are slow onset. So disasters like drought. Drought doesn't just happen. It doesn't just come. It's not a disaster like fire that can just happen in an instant and the whole building or whatever is burnt to the ground. So some disasters are slow onset like drought. I think some floods can also be anticipated to a certain degree. So under disaster preparedness, we try to find ways on how can we respond and reduce the impact of a disaster before it happens. So that's in terms of disaster response. So there's a difference between response and preparedness actions. We also acted in health and social care, whereby the RCCE there stands for risk communication and community engagement, which basically means health promotion and then establishing linkages to the existing support services. So RCCE is basically the two things that are there. Health promotion, like I said in the beginning, we advocate in communities and with stakeholders if there is a health crisis. I know in Swakopmund not long ago, we had an outbreak of hepatitis E. Red Cross also had volunteers advocating in the community. I think it was in DRC, was one of the risk areas. We're basically speaking to community members on what causes this hepatitis E and how can they prevent themselves from getting hepatitis E. We also work in the food security and livelihoods. Basically, food security, we're dealing with agriculture issues, water accessibility, and then nutrition. So agriculture, we work mainly with farmers, mainly small-scale farmers, so like families who just farm to feed them their, what is this? You guys know subsistence farms, right? I forget, like I was also in school at some point and I learned these things. So for those of you who do agriculture, you know what subsistence farming is. Basically farming to feed yourself and then perhaps sell any surplus that you have. So we have a lot of those farmers in Namibia, and they have lots of issues affecting their farming, right? So we support by providing training to farmers on best practices. We also sometimes provide them with extra equipment, or if they need seeds, things like that. We support agriculture. In terms of water accessibility, I don't know if you know, in Erongo, I can only speak for Erongo because I represent this region. There's an issue of water scarcity in the Davos constituency, so that's like Omaruru area. Omaruru is its own constituency, but that area of Omaruru, there's an issue of water scarcity. So what do we as Namibia Red Cross do in such a situation? We could perhaps, what is this? Build boreholes in that area, or we could rehabilitate boreholes in that area. Or if the worst comes, we could then have water coming in, bring water into that area as aid, basically. And then also we deal in the area of nutrition. Nutrition basically is, I think the one main thing that we do is providing food parcels. So like food packages, if there's a serious issue, we then would respond with food parcels. We also have as a focus area, training and capacity development. And one of the main ones is first aid. We provide first aid training to individuals, communities, and then companies. If you as an individual, even now, would like to receive first aid training, you can approach us. And then there's obviously course fees, which are very low. I have them at the back there in case you want to know more about that. You can approach us and then have your first aid training. We provide from the basic level first aid training up until the advanced first aid, and then we also provide like a first aid trainers course. So if you do want to become a first aid trainer, we can also provide that course for you. All right, then also under training, we also provide Red Cross and Red Crescent movement tools and approaches. And one of those is what we call CEA, that's community engagement and accountability. We basically teach people how to engage communities. It's not an easy thing. So yeah, this is one of the, something that you would like to learn how to do. You can approach us and then we can facilitate that training. We're also very active in humanitarian diplomacy, and that is basically evidence-based advocacy. So humanitarian diplomacy basically means, because we work with government, we are in a better position to advocate for the needs of people and their communities at that level of government. So because we, through CEA there, community engagement, we know what is happening on the ground with community members. We know their needs. And then we're able through humanitarian diplomacy, then advocate and speak to organizations like the government and other aid agencies, and then bring those needs to them, and then see how we can respond to those needs together. So that's just a bit of like the main, an overview of what we do at Namibia Red Cross. Our work basically has a governance structure. I don't even know if I'll simplify this. So we, what that first one means is we basically a Section 21 organization, which means we are a non-profit organization. We are registered with the Ministry of Health as a welfare organization, and our governance structure consists of elected national board members, a finance commission, and then regional and constituency boards as well. So our General Assembly is the highest decision-making body. If you come to the stand after this presentation, you will hear some of the ways you can be involved in the Red Cross even now, either as a volunteer or as a member. And members mainly are involved in those last 2 points, where they can be part of the National Governing Board, the Finance Commission, or the regional and constituency boards, and then also be able to attend the General Assembly, which is the highest decision-making body of the National Society, basically. So you get to contribute to basically the work that we do, right? You get to make decisions on the work that we do. We have a regional board in Erongo. It's an interim board. And yeah, we also have youth members. This is just the national governing structure. We have chairperson, vice chairperson, second vice chairperson, there's a treasurer, and a secretariat, there's a legal advisor, and then additional members are the different chairpersons of the regional boards. They also are part of the national board. All right, I'm almost done. The principal objective of the National Society is to prevent and alleviate human suffering with complete impartiality, making no discrimination as to nationality, race, sex, religious beliefs, language, class, or political opinions, or any other similar grounds, right? Like I said, we work in line with the fundamental principles, as well as set humanitarian, basically standards, like the sphere standards. We're operating in 10 regions. It says 11 there, but it's 10. Commerce region, where the head office is in Windhoek, Oshodanjupa, where we're in Grootfontein, Kunene is in Opuo, and then Omsati, Otapi, Oshikote is in Onipa, there's Ohangwena is in Enana, and then basically Erongo is in Swakopmund. So those are just the different places where you can find a Red Cross branch, where the regional head office is, in case you find yourself in one of those regions or towns, then you know where to find the Red Cross branch. Those of you who are going to Windhoek, perhaps you want to be a volunteer in Windhoek, or you want to do your internship in Windhoek, or a member in Windhoek, you can do that. All right, so I'm done with this part of the presentation. Now, just to explain like some of, I know this is a career fair. So like after what I just explained, what we do, some of the ways you can be part of Namibia Red Cross now while you're still in high school is either to become a volunteer or a member. Now, volunteers basically support that we work, support the everyday work that we do. Either we have volunteers supporting the work that we do in the office, admin work, or we have volunteers that support when we're responding to a certain situation. If we're responding to fire, we always need extra hands. If we're raising funds, we need extra hands. So we're always signing up volunteers. Members, like I said, more governance activities, board work, and then we also have a youth governing structure. So the youth members, which are basically high school students, and then some people that are just like fresh out of high school, still young, basically we also have like a youth structure, and you basically get to contribute to all the youth activities that we do in a certain area. You basically drive the youth agenda of the Namibia Red Cross, basically. And for Erongo region, since this is a new branch, we just opened the branch last year, we still don't have a complete youth structure. So I'm encouraging you, if you want to get involved, please do sign up as a youth member, and there'll be activities that we'll be taking, that we'll be conducting. So if you want to be part of like disaster management, if you want to work in disaster management sphere, you can go study disaster management, or you can do what I did and then either study business administration or social work, and then so that's as a general, or you can study business administration, and then specialize in disaster risk reduction. And then you can come and work in as a disaster manager or as a project coordinator. You could also study project management. And that way you're able to come and work in the programs, what is this, department. If you want to work in food security and livelihoods, you study agriculture, food science also, then you can be active in that. The good thing about Namibia Red Cross is there's almost always, for almost every course that you want to do, whether it's finance, science, humanities, even if you want to be a medical doctor, there's almost always a place for you within the Red Cross. We need accountants. If you want to study finance, we need accountants. We need lawyers in the Red Cross. So a good thing if you, we're not a university, so, but what we can do is if you're a volunteer, so if you do volunteer, you can then come do like an internship with us, or we can basically help you like in your studies, because when you study, you usually have to do an internship basically before you graduate. So you could, if you are a volunteer already like now, and then when you go study and you come back, or if you're in an internship and you sign up to be a volunteer, you can basically come do your internship by us, whether it's in finance, law, or whatever it is. And for now, if you want to know more information, I'm at the back. Or if you want to sign up as a volunteer, remember, over there. Do I take questions now? Okay. Are there any questions? I know that was a lot.
I just want to know, what are the chances to get, you said they must study, but what's the money like to work for the Red Cross?
What's the salary, basically? Yeah. I like it. A good thing to note is that the Red Cross is so we're basically a volunteer organization. So a central thing is that our staff and our volunteers are not, motivated by any personal gain. But I mean, we offer the same salary as any other organization, I think. It's within the same range. So if you do study like business management and you're a business manager, or you're at the level of a project coordinator, I think the salary is relatively the same as with any other organization, because we are a registered organization. So yeah, it's about the same in terms of salary.
And who's paying? National central body or?
Yeah, basically, who's paying? Or are you asking what pays your salary, or where does the money come from?
Yeah.
Okay, so basically the money comes from our different donors. So we either have international donors or like partner Red Cross societies. Say German Red Cross provides 2 years worth of funding for us to fund different things, and salaries could be included. That's where one salary comes from. So we're donor funded, so all our funds basically come from different donors, either they're an organization or they are an individual. So yeah. Yes.
How long does the first Red Cross take?
So it depends on the different. Was this thing off the whole time? No. Okay. It depends on what level of first aid course you want to do. Are you doing basic first aid? That is only 1 day. If you're doing class A first aid, which is the second level, that's 1.5 days. If you're doing class B first aid, which is the advanced first aid, that is a 5-day course. Sorry, class B is 3, class A is 3 days. The basic first aid is 1 day. Class A is 3 days, and then class B, which is advanced, is a week's course. And then obviously we have also the training of trainers. So if you want to become a first aid trainer, I think that course is about 2 weeks or so. And then, yeah.
How much does that cost?
I don't know the exact cost for each course, but I do have the information there at the back. So if you're interested in finding out those costs, the pamphlets are there.
And if you become a member of the Namibia Red Cross, you also become a member of the International Red Cross Society.
Yes and no. So you are, if you are a member with Namibia Red Cross, or if you are a volunteer, or if you're a staff, you get to You're basically affiliated with the IFRC or the ICRC because you'll be involved, say if you're a member. IFRC also has members. The other Red Cross Society also have members. And there are sometimes activities that we do together. And so you're exposed to that, basically those types of programs and activities. So you are affiliated in some way, but not directly. You're a member of Namibia Red Cross Society, but you're exposed to the other national societies or the ICRC or the FRC. So,
and if you're a member, what do you get a membership card? Or?
Yes, you do get a membership card. We've moved our system, our registration process online, so it's very quick and easy. We can do it like in 2 minutes, and then you get a membership card after you pay your membership fee. Youth membership fee is like $5 annually. So and then adult membership is $20 annually, and then you can either choose to become a lifetime member, and then you pay a membership fee of $100 once off, $100 Namibian once off, and then you get your membership card.
Okay. Listen, you're gonna be here for 2 days, right? Today and tomorrow, all day.
Not quite, but yeah, I'm here for today. I unfortunately, yes, I was supposed to be here for 2 days, but I need to travel tomorrow. Yeah, we work in a very unpredictable, what is this? Yes, so I have to, yeah, no, so I won't be here tomorrow.
Okay.
Yeah,
so
I've got to
must
travel.
sign up now, we'll just get information that they can
Yes.
sign up online.
So what you can do is you can either sign up now, even if you want to sign up as a member, and you don't have your membership fee now, you can still sign up, and then we can arrange for you to, settle that later, or you'll have my contact details. I can give you my contact details, you can take my card, and then later on you can make contact to sign up as either one, a member or volunteer.
Fantastic.
Right.
All right. In the back of the aula, on the left-hand side, there in the back, you will find pamphlets and information about the Red Cross. Our next